From WREL News and the Capital Broadcasting Podcast Network, this is your Coronavirus North Carolina News Brief for Thursday, June 11th, 2020. I'm Cliff Baumgardner. Here's the latest from WREL.com. Today, state education and health officials discussed how to allow students to return to schools in the fall. Schools will operate under one of three plans, depending on the severity of the coronavirus in the state. Governor Roy Cooper has said a decision about the coming school year will be based on health data as of July 1st. Most public schools on a traditional calendar are scheduled to resume on August 17th. Schools are being asked to come up with three levels of COVID response, ranging from almost normal classrooms with minimal social distancing requirements to half capacity to students staying out of school and a return to remote learning. Face coverings will be strongly suggested. Daily temperature screenings of students are required, as are screenings for symptoms like fever, chills, and cough. Cleaning and hygiene requirements and recommendations are also part of the guidance. Across the state, different districts might be operating under different levels of those limits based on outbreak data. The plan also lists requirements for protecting high-risk students and staff, how to deal with suspected cases of coronavirus, and how to best support staff and student mental health. Speaking about the plan, NC School Superintendent Mark Johnson said, quote, "If our state metrics are positive, local school districts will be able to take steps to safely return students to the classroom, while also ensuring schools can accommodate students and teachers who may have health concerns. If, however, our great state takes a turn for the worst, all schools will follow more stringent guidance." Today, state lawmakers signed off on a bill to allow beginning drivers to obtain limited provisional licenses without passing a driving test administered by the Division of Motor Vehicles. The DMV stopped administering road tests in March because of the coronavirus pandemic, causing problems for new drivers seeking to be licensed. The final version of Senate Bill 158 is more limited in scope than some earlier versions. The waiver would apply only for beginning drivers age 18 or under who are seeking a Level 2 provisional license, and it will expire when the DMV goes back to offering the tests again. Drivers would still need to pass a DMV road test to obtain a full Level 3 driver's license. In addition, students who were enrolled in driver's education courses this spring will be considered to have completed it as long as they finished 15 hours of classroom instruction before March 16th. They must also have finished 6 hours of behind-the-wheel instruction from a parent, guardian, or other licensed driver. Sponsors say the bill will help reduce the backlog at the DMV when road testing resumes. The Senate and the House both passed the bill today. It now goes to Governor Roy Cooper, who has 10 days to sign it, veto it, or allow it to become law without his signature. Earlier this week, Dr. Mandy Cohen, Secretary of the North Carolina Department of Health and Human Services, said the state will do a round of proactive COVID-19 testing at every nursing home in North Carolina. Nursing homes and assisted living facilities have been hit particularly hard by the pandemic, with their residents making up at least 60% of North Carolina's total deaths from the virus. Starting in early April, the state forbade communal gatherings, including meals at skilled nursing homes, and it recommended similar measures at assisted living facilities. They also mandated health checks and mask wearing for nursing home staff and daily symptom checks for residents. The state strongly recommends that facilities not allow visitors except for end-of-life situations. When it comes to COVID-19 cases and deaths in nursing homes, North Carolina is in the middle of the pack compared to other states. According to data reported to the U.S. Centers for Disease Control and Prevention, and based on numbers through the end of May, North Carolina has about 55 confirmed nursing home cases per 1,000 nursing home residents, and 12.6 nursing home deaths per 1,000 residents. Dr. Cohen says this week the state tested everyone in its state-run nursing homes, and private facilities are next. And lastly, less than a week after Governor Roy Cooper blocked an effort to reopen bars during the coronavirus pandemic, state lawmakers have doubled down on their effort to ease restrictions on North Carolina businesses by sending him a measure that would not only reopen bars, but gyms as well. Yesterday, the House voted 69-50 in favor of the measure, following the Senate's 36-13 vote on Tuesday. The new bill would limit gyms to 50% capacity, the same level as restaurants, and would require staff to wear masks and have their temperatures checked. People working out would have to follow social distancing guidelines, and equipment would have to be disinfected frequently. Bars would be restricted under the bill to serving customers in outdoor seating areas equal to 50% of their indoor capacity. Restaurants would also be allowed to expand their capacity by providing outdoor seating. The governor noted when he vetoed the first bar bill last week that the legislation prevented him or public health officials from closing bars down again if coronavirus infections were to spike in the coming weeks and months. The latest bill allows such reclosures as long as the majority of the Council of State, a group of 10 elected officials led by Cooper, supports the move. The new bill now goes to Governor Cooper once again. This has been your Coronavirus North Carolina News Brief for Thursday, June 11th, 2020. As always, if you like the information and resources you get from this show, let us know. Leave a rating and review wherever it is you listen. And while you're there, don't forget to subscribe so you don't miss our new episodes. Thanks for listening.